Now let me welcome Ms. Mridula M.K, who is joining us from India. Yeah, we can see you. If you can unmute your microphone and start with your presentation, which is called Medical Plants in Ayurvedic Medicine for Cardio Protection, a Promising Research Area. The floor is yours. Madam Mridula, please start your presentation.
Okay, thank you. Namaste. Myself, Dr. Mridula, a research scholar from Department of Dravya Guna Vijnana, Ayurveda specialty for pharmacology. Currently, I am doing my PhD studies at Government Ayurveda College, Tripunitura, India, under the guideship of Dr. P.Y. Ansari and Dr. Sara Monsi Uman. And in today's Congress, I am going to present the topic Medicinal Plants in Ayurvedic Medicine for Cardioprotection, a Promising Research Area. Let me start the presentation with current scenario of cardiovascular diseases. As per the World Health Organization statistics, cardiovascular diseases causes million deaths per year, accounting for 31% of all death worldwide. And the prediction, and there is a prediction that CVDs kill more than 22.2 million people annually by 2030. And surprisingly or unluckily, we can see low and middle income countries have a higher prevalence of CVDs among older adults. And this will create a significant challenge for the healthcare system in future. How to overcome this challenge? We all know the management or prevention of CVDs requires adequate lifestyle management, risk factor management, and proper adherence of prophylactic drug therapies or drugs that are used for treating the cardiovascular diseases. But the reports from surveys in Europe and United States shows inadequate lifestyle, risk factor management, and underuse of prophylactic drug therapies in patients diagnosed with CVDs or in the CVD prevention strategies. So adherence to medication, it plays a major role in the prevention and management of CVDs. And from this survey pointed out a poor adherence to prophylactic drug therapies. All these pointed out the need for a new approach for CVD prevention, both in primary and secondary level. So the role of cardioprotective drugs in the prevention of CVD is a well-known factor. So how can we utilize the cardioprotective drugs for the prevention of cardiovascular diseases? Recently, Wald and Lowe proposed a theoretical cardioprotective pill, and the current evidence on the use of this poly pills showed an improvement in CVD risk factor levels and adherence to preventive medications. So the same thing we can see when we look back into behind the centuries. Most of our traditional medical systems are using multi-ingredient formulations for the management of diseases, including cardiovascular diseases. So considering all these factors, it is the time to utilize multi-ingredient formulations of traditional forms of medicine in preventive cardiology, following the concept of polypill. Now let us see how can we utilize Ayurveda polyherbal formulations or single drugs in CVD prevention. Under the heading of Hridroga, Ayurveda describes a variety of single drugs and formulations for treating cardiovascular diseases. Based on their effects on CVD risk factors and symptoms, these formulations are comparable to polypills, and we can utilize them as an add-on therapy or standalone treatment depending on the patient's condition or the stage of the disease, etc. We all know a cost-effective healthcare system and personalized medicine will be the future of preventive cardiology. So a personalized approach followed by Ayurvedic principles will definitely help to develop an integrated approach in the prevention of cardiovascular diseases. So all these are the background related to the use of Ayurveda in prevention of cardiovascular disease. Now let us see some cardioprotective drugs and some scientific evidences on the use of them in cardiovascular disease prevention or management. So first one is Arjuna. This is the Sanskrit name given for the plant Terminalia arjuna of Combretaceae family. And in Ayurveda, physicians used to prescribe medicated milk and stem bark powder of Terminalia arjuna as a cardioprotective agent. And these are some experimental evidence for the use of Arjuna for the cardioprotection. Beneficial effects in experimentally induced myocardial ischemia, hypertrophy, fibrosis, and other cardiovascular diseases. Boosts antioxidant activities, prevents fibrosis, protects against ischemia reperfusion injury, antihypertensive effects, and the atherogenic activity. These are some experimental evidence on the use of bark extract of Arjuna. And the next one is Arjuna Ksheerapaga. Arjuna Ksheerapaga is a formulation. It is prepared by boiling Arjuna bark in milk and water in a specified ratio. And this is described in Chakradatta, a classical textbook of Ayurveda. And it is widely prescribed by Ayurvedic practitioners as a cardiotonic. We all know the reason for diseases including CVDs include sustained or excessive chronic inflammation fueled by oxidative stress. So the drugs with anti-inflammatory and antioxidant activity will be beneficial for the prevention and management of cardiovascular diseases. And recently, some researchers validated the therapeutic anti-inflammatory potential of Arjuna Ksheerapaga by in vitro and in vivo studies. They tested the antioxidant and anti-inflammatory potential. The results showed a good anti-inflammatory activity in hypoedema model of mice. They conducted the study in hydroalcoholic extract and Arjuna Ksheerapaga extract. The results showed the efficacy of hydroalcoholic extract was more than Arjuna Ksheerapaga at early phase of inflammation, whereas in late phase of inflammation, Arjuna Ksheerapaga was more efficacious and equipotent to hydroalcoholic extract. Thus, regardless of low in vitro antioxidant activity, Arjuna Ksheerapaga exhibited potential in vivo anti-inflammatory activity. This results pointed out or give some evidence for the use of Arjuna Ksheerapaga in the management of cardiovascular disease. And next formulation containing Arjuna is Partha Arishtam. It is a self-fermented alcoholic preparation used by Ayurveda physicians for the management of cardiovascular disease. It is described in Bhaishya Ratnavali Hridroga Adhikara, a classical textbook of Ayurveda. Partha Arishtam is popular for its cardiotonic properties, nourishing. It is supposed to be nourish and strengthen the heart muscles, promote cardiac function by regulating blood pressure and cholesterol. Cardiotonic and cardioprotective roles of its ingredients are reported on animal models. And these are some experimental evidence on the cardioprotective effect of Partha Arishtam. First one is an in vitro study, and in this study, the antioxidant activity of Partha Arishtam is tested in H9C2 cells. The extent of cell viability of the Partha Arishtam treated H9C2 cell lines were subjected to MTT assay as a confirmatory assays for antioxidant activity and in vitro ROS management assay and reverse transcriptase PCR analysis was conducted to confirm the expression of NRF2 gene against oxidative stress. And the results shows on MTT assay the cells treated with 25 mg per ml of this Patharishta provided an average cell viability of 85.12%. The confirmatory assay conducted in the cells at this concentration showed that the ROS production is relatively low and the NRF2 gene against oxidative stress was expressed in these cells. The findings of the study reveal the formulation Patharishta possesses significant antioxidant as well as free radical scavenging activity and therefore may be considered as one of the good sources of natural cardioprotective formulation. And the second study was an in vivo study. It is conducted in isopreterenol-induced myocardial infarction in animal model. And the study result also pointed out the beneficial role of Partharishta in cardiovascular diseases. These are the experimental evidences on the plant Arjuna as a single drug and in formulation. And the next one is Lashuna. This is the Sanskrit term for Allium sativum of Liliaceae family. Formulations with bulb of garlic and medicated milk has been in use for the management of cardiovascular diseases and risk factors. Coming to the formulations, first one is Lashuna Kshira. Just like the Arjuna Kshira Paga, medicated milk of garlic also will prepare in a specified ratio and used for the treatment or prevention of cardiovascular diseases. And this formulation is described in Bhaishaji Ratnavali and Charaka Samhita. Both are classical textbooks of Ayurveda. And an in vitro study conducted in Lashuna Kshirapaga shows that Lashuna Kshirapaga decrease the force of contraction of the heart and heart rate, and it is negatively inotropic and chronotropic, and they act on muscarinic receptors of the heart. Next one is a polyherbal formulation with Allium sativum as an ingredient. This is a common formulation prescribed by Ayurvedic physicians for the management of hypertension and dyslipidemia. It consists of 4 ingredients, including Lashunam. The other ingredients are Nigella sativa, Piper longum, and Desmodium gangeticum. And the next one is Ashtavargam Kashayam. Garlic is one among the 8 green ingredients of this decoction also. And this decoction is commonly used by Ayurvedic physicians for the management of hypertension. And there are some more plants that I have listed in this presentation. Gugulu, it is botanically identified as Commiphora mugul, Pipali, Piper longum, Shundi, Zingiber officinale, Pushkara moolam, Inula racemosa, Haridagi, Terminalia, Chebula. But all these medicinal plants shows pharmacological activities like antioxidant activity, cardioprotective activity, anti-atherogenic, anti-inflammatory activity, etc. But all these activities are very beneficial for utilizing them in the management of cardiovascular diseases. Now, I am coming to the concluding slide. Ayurveda has so many unexplored areas, especially its formulations. In the management of complex diseases, drugs that act on multiple targets are gaining scientific attention. People are increasingly choosing traditional medicine due to its cost effectiveness and fewer side effects. Likewise, polypill use has accelerated its importance since these medicines have been used for centuries as a result of their synergistic effects. It is therefore important to have a detailed pharmacological, biochemical, and biomolecular understanding of Ayurvedic drugs and formulations, and this will definitely support its use in preventive cardiology, both as an additive therapy and as a standalone treatment, considering the patient's condition, disease condition, etc. And these are the references, and thank you so much.
Let me thank Dr. Mridula from India for her presentation and making it clear for us how the medical plants can help with the help of Ayurvedic medicine for cardio protection. Thank you very much for that.